Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Leprosy. What is leprosy? Leprosy is a chronic infectious age-old disease caused by a bacterium called Mycobacterium leprae, mainly affecting skin, peripheral nerves, muscles, lining of nose and of respiratory tract. It is also known as Hansen's disease, since Dr. Hansen first determined the causative organism of the disease. What are the late effects of leprosy? Late effects of leprosy are nerve damage, skin ulcer, and weakness of muscles. Finally, if left untreated, leprosy brings about severe disfigurement and significant disability. Which are areas of the world where leprosy reigns? It reigns in tropical and subtropical areas of Asia and Africa. What are signs and symptoms of leprosy? Reddening, inflammation and ulceration of skin with no response to anti-inflammatory drugs. Leonine face. Leonine face means this face like that of a lion. Lion. These foreheads are, the lion's forehead are severely furrowed. This is the persons also have the same. Others also symptoms are there. Clubbing of fingers. Fingers are clubbed. Spade-like hands with clawing. Spade-like hands with clawing. Claw-like appearance of fingers. Fingers are like claw. These are the symptoms, and all these symptoms are almost like that of a lion. Weakness of muscles. Numbness in fingers, hands, feet and legs with decreased sensation of touch, heat and pain. How does leprosy spread? Leprosy is not acutely contagious. It spreads through droplet infection of mucosal secretion of an infected person. Close and long contact of an infected person is necessary to spread the disease. The disease is slow to develop. Incubation period is as long as 5 years. It is from World Health Organization. They say there is incubation period of almost 5 years, and highly resistant to treatment with ordinary remedies. Symptoms may not appear as long as 20 years. That is, these 5 years in some cases may extend to 20 years. Who classified leprosy? Depending on the type and number of affected skin areas, who classified leprosy into two types. Number 1, paucibacillary. Lesions less or equal to 5, no bacterium detected on skin. Multibacillary. Lesions more than 5 and or no bacteria or bacteria detected on the skin. Here no bacteria, here bacteria. That means in this case lesion 5 or less and on skin bacteria presence. No, not present. Here lesion number of 5 or more and bacteria, that is Mycobacterium leprae, present on the skin. How can leprosy be prevented? Carefully avoid contact with active patients. For household contact, immediate and annual examination for 5 successive years must be conducted. That is, one must be tested for leprosy. There are tests such as skin biopsy or lepromine tests. This test must be conducted to assure that whether the infection is there or not. Please remember, there is no specific vaccine for leprosy. However, vaccine BCG provides partial protection since organism for leprosy belongs to the same group as that of tuberculosis. In case of doubt, get lepromine skin test done to be sure. Is leprosy fully curable? In modern medicine, it is fully curable with multiple drug therapy. In homeopathy, there are so many remedies to choose according to totality of symptoms, and it is an age-old, time-tested matter. The lepromin tests are being done here. This is the picture, lepromin test. What are complications of leprosy? Disfigurement, hair loss especially from eyebrows, eyelashes, permanent nerve damage in arms and legs, inability to use hands and feet, iritis, glaucoma, optic nerve damage, blindness, chronic nasal congestion, nose bleeding, permanent damage of nasal septum, kidney failure, erectile dysfunction, infertility. Is leprosy diagnosed? How is leprosy diagnosed? Local examination, skin biopsy, and lepromin skin test. With the help of these three, the leprosy is diagnosed confirmed. Now we are taking remedies. CPR for leprosy, swelling of forehead around temple, face thick covered with tubercle. Leonine face. Leonine face means the face looks like a lion. Tubercles and spots all over the body, white spots and ulcer on the articulation of fingers. Now petroleum for leprosy. Tubercles in face, ulcer on fingers, tibia, hoarseness, suffocating cough, numbness of extremities. Madaru alb or indigo orient for leprosy. Whole surface of the skin becomes leprous and thick, livid and gangrenous tubercles. Silicea for leprosy. Induration of nose with ulceration and discharge. Netramcar for leprosy. Spots and tubercles all over the face, arm, thighs, legs, which ulcerate. Anacardium for leprosy. Numbness and feeling of pins and needles in affected parts which are cold. Perfect anesthesia of affected parts, weakness and prostration. Anesthesia means loss of sensation. Arsenic for leprosy, spots are yellow or white, burning ulcer at the end of fingers, toes, navel, cheek, tubercles raised up, hyperesthesia and anesthesia alternating. That is, first one time hyperesthesia, then it is becomes anesthetic part, then again it is hyperesthesia, it is alternating. Colosynthesis for leprosy, desquamation of whole epidermis, abscess in axilla. Alumina for leprosy, copper, cold, tubercle in face, lepra spots in lips, lips swollen, nose heavy, ulcer on planta pedis. Planta pedis is a particular place in the foot. It is actually sole area. This portion is called planta pedis. This portion. Graphitis for leprosy, lepra spot, coppery annular, raised on the face, ears, buttocks, legs, feet. Obturation of nose. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write it in the comment section. I would certainly attend.